Exactly, 12:30 this Wednesday, and our man, our pharmacist, James Geraghty, in studio and ready to roll. James, isn't it hard to believe 2026?
I cannot believe it, Ger.
Oh, frightening, isn't it?
Incredible.
Anyway, are you ready to roll?
I'm ready to roll, Ger.
Rock and roll, baby. Here we go, James. A lady says that her eyes are always sore and she feels like salty tears, and they can be sore too. What would be the cause of these salty tears and sore eyes?
Well, it sounds like, number one, she'd need to be talking to an optician or a GP. It could be touch of blepharitis, or it could be an infection in the eye, Ger. Now, usually if somebody came in with something like that, I'd usually recommend maybe a little bit of rolling for about 4 times a day for about 5 days. If that's not clearing it up, then she'd need to have a chat with her GP, because it could be an infection there along the ridge line of the eye, or even the lacrimal gland may actually be affected as well.
Eyes are probably delicate too, James.
Very, and they have to be. You've only got 2 of them, It's
Yeah.
important to mind them as such, So even popping into the optician, because they're fantastic professionals, and just they can have a look at it, and they're really good. And I know sometimes what they recommend is a warm cloth on the eye before you go to bed at night. And what it does is it just frees up any issues, blockages around the eye area. Just a little warm cloth and just leave it on the eye, not hot, just warm, and leave it there for a little while.
Can I ask, that we're on that subject and we leave it, so people get styes in their eyes.
Yeah.
And people would say a tea bag on a
Yeah,
stye. Did you ever hear that?
I have seen it work, Ger.
You've seen it work?
I have seen it work.
Wow,
Yes,
there you
yes,
go.
I have. I've seen people come in and they'll have a stye in their eye, and we'll give them something, and it won't go away, and they'll come back a couple of weeks later and say the tea bag worked.
Amazing.
So,
We move on. A lady had her knees replaced 5 years ago, but the bones still crack. Why would that be?
well, sometimes people talk about vacuums in the and where compression happens between, and then compression comes off, and you get this crack.
Right.
And it's quite common, Ger. But ultimately, I'd love to know, is she pain free? If there's a crack there, I wouldn't be overly worried, because most people will get that, and if she is, recommending something there, I don't think would be a good idea, because if it's a crack and she just hears something like that, but everything else is going okay, she's fine.
Purely mechanical.
Purely mechanical, yeah.
What James asked James, can one take milk thistle safely? Already taking L-troxin, Bicop, 2.5 milligrams, and telmisartan. Is that right, James?
Telmisartan.
Telmisartan, 40 milligrams, TIA. Also is milk thistle safe to take? I'm on Sotacor, 80 milligrams daily, amylode 5 milligrams daily, and candistratin 60 milligrams daily. God, that person is on a lot.
On a good bit of medication there, Jerry.
Is that all related to
all related to blood pressure more than anything else, Jerry?
Okay.
Now, if we look at milk thistle, a very effective product to give a boost to the liver. It's the active ingredient is silymarin. What it does is it works. It's basically like a booster for liver function. The only thing is, it can affect something called the cytochrome P450 system, which is found in the liver. And what that does is very, very important in the breaking down of different medicines. Now, in this particular case, this patient is okay to take the milk thistle. But if the patient was, say, taking blood thinners, statins, antidepressants, anything like that, there would be an issue. They'd have to talk to their pharmacist or the GP if they were taking the milk thistle, because it can have an impact, especially around blood thinners. And we've talked about that before.
Yes, you have. Yeah.
If you are taking blood thinners and you're deciding to go on a herbal or a vitamin or anything like that, have the chat with the pharmacist. It's very, very important.
And can milk thistle be got over the counter, Joe?
Yes, Ger, it can. And milk thistle, it's a combination found in many products, because it's very, very good at flushing out or detoxing the body. Say, for example, in the new year, where people are, deciding to overindulge or whatever, and they'd go on, say, a combination or milk thistle for about a month, and it's really good at just clearing out the liver and just, cleaning out the pipes.
So just about a month once.
Just about a month, Ger, just to give the liver a little bit of a boost.
But if you're on blood thinners,
you must be aware and call in, talk to your pharmacist. Do not go on anything like milk thistle or liver blend or anything like that if you are taking blood thinners, statins, or antidepressants. Okay. If you are taking, say, for example, what this person is on around blood pressure tablets, they are fine.
Okay. Good morning. My daughter is 11 and takes a while for her to fall asleep. What would you recommend best as a supplement for her sleep and her hormones? She's a celiac also. I use Mag 365 and a multivitamin currently. Now, is the person using it for themselves, or are they giving their daughter that combination?
That's a very good question, Ger. The daughter is under 12. I would be asking the lady to bring her daughter to her GP. In the meantime, she could use something like a Passiflora or a valerian tea bag and make up a little drink for her at night. But anything around that, and I mean, her sleep and hormones around that age, you know, there is a lot happening.
Okay.
And we have to be aware of that. We have to be aware of the child. And obviously, her mum is concerned that she mightn't be falling asleep. But sometimes sleep can be a little bit disrupted. If she is taking the Mag 365, I would take it maybe a little bit, maybe an hour or two before she goes to bed, and take the multivitamin in the morning. Right. Yeah, take the multivitamin in the morning, take the Mag 365, maybe an hour or two before she goes to bed. Also, the celiac issue, that may have a predisposition to keeping her awake, maybe around her digestion or whatever. Yes. But in that case, a valerian tea bag, and make it up maybe with a small drop of orange juice after she has put it through some hot water. But she needs to be careful there. I wouldn't be overdoing that one.
And when you say you wouldn't be overdoing, what do you mean by that?
I wouldn't be going in and getting, you know, recommendation of tablets or anything like that without recommendation without recommendation of the GP. There is a melatonin form that patients can get for younger children, but again, that has to come through the GP.
And the valerian tea bag substance?
Valerian, you can get them over the counter, Jerry.
How long before she goes to bed, James?
I would recommend maybe about an hour.
Okay, yeah. All right. James, are lansoprazole tablets a safe tablet to be taking long term? I heard they can affect your memory if taken long term. Is this true? Please advise. What is that medication?
Lansoprazole is a H2 antagonist, Jerry. Basically, it stops acid production in the stomach, so it's very good if you're feeling a bit off or ulcers or anything like that. There are a couple of studies out there suggestive of what this person is talking about, but in the main, they're very, very safe. Okay? If a person is feeling that their memory is becoming affected, or they're on lansoprazole for a long period of time, have the chat with the pharmacist or their GP and just see where they stand on it. Usually, sometimes people are put on the lansoprazole or omeprazole or whatever more as a preventative or a caution, and they can get really good healing. So sometimes they can have a discussion with the GP maybe to come off it or whatever, but that has to be at the discretion of the GP. But ultimately what we're looking at here is there long-term effects of using lansoprazole? There's a couple of studies that may be suggestive of it, may be associated with it, but doesn't actually cause it. So that's important.
Right.
But the overall benefits of lansoprazole are very positive. Very, very positive.
Any possibilities with the memory loss?
Yes.
Okay. James, any cure for neuropathy 10 months after chemotherapy in the fingers, but worse in the soles of the feet and the toes? I'm very active and I walk a lot.
This is quite common after chemotherapy, Jaron, and you get a damage in the nerves, especially in the fingers area. You know, and they can become quite sore, tender, pins and needles and things like that. There is a couple of products out there, and the one thing I would suggest for that lady is definitely B-complex and an omega-3 for a period about maybe 4 to 5 months. Some people go on particular types of antidepressants for nerve pain, duloxetine, for example, but again, that's at GP discretion. But it's important to know that for that person, there are therapies out there for it. And I'll be completely honest with you, Jar, I'm trying to get the name of one. It slipped my mind, and I sent a text to my wonderful colleague Maria, but she's looking into it for me. So hopefully by the end of the program, we should have it, okay?
Or what we will do is we'll go to Facebook afterwards for questions we haven't got to. Maybe we can
absolutely, Jar. That's perfect, Jar.
All right, now James, could you recommend the best drops, please, for dry eyes?
Well, I found the Hyalofort dry eye very good, Jar. Very good, very simple to take. It's liquid and viscous, so it'll stay in the eye, and I found it very, very good, especially for around the cornea where it can sometimes become very, very dry, especially if you're working in aircon or air-conditioned areas. The Hyalofort was very, very good.
The one, okay. Yeah. And James, is that over the counter?
You can get that over the counter, Jar. If you go in now, there is a number of them. Don't go in and just say Hyalofort. Just make sure you mention
explain what you want.
Because there's one for Hyalofort Night, for example, but if they talk to the pharmacist or the over-the-counter assistant, they should be well able to help them.
My cholesterol is 6.2, James, but my GP won't give me statins because my blood pressure and weight are normal. Any suggestions of alternatives, says Kath.
Well, Kath, I can tell you that I was at my GP before Christmas and he came back to me and my cholesterol is 5.7, my LDL is 3.3, and he isn't giving me anything either. I said to him, I said, what do you think I should do here? And he just turned and says, James, keep doing what you're doing. So on that basis, what I'm doing, Ger, and I give it to Kath here, I'm taking Multifiber Plus, resveratrol and red yeast rice, and I'm doing that for the next 6 months. So we'll see how we're doing in July, August, Ger. I'll be able to tell you because I have to go back to my doctor and just see what the actual story is then. But 6.2 is not bad. I feel if that lady, she looks, say for example, at putting in more fibre in her diet, she uses the resveratrol and uses something a little bit stronger, maybe red yeast rice, and that combination, she should see a big improvement.
Do you worry about your cholesterol?
I'll tell you what, Ger, I think the most important thing, especially for men, women are fantastic, men need to go to the doctor once or twice a year, right, especially once you go over 50, just to get the cholesterol, PSA, and all the other parameters. I was a little bit surprised that it had gone up, Ger, I have to be honest with you, but in saying that, I have been taking this in frequently, but I'm going to be consistent now for the next 6 months, and then we can have a discussion about it in about 6 months' time. Yeah.
I would be grateful if you would ask James, did he ever hear of anyone using hypnosis for pain relief? I had a knee replacement 3 years ago, and it didn't work for me. I've tried everything. I'm a 64-year-old woman.
Well, I have to say, Ger, I haven't heard of anybody using hypnosis, but I know people who have used hypnosis for different aspects of health, and they have found it very effective. Would it work for pain? Obviously this is a physical or mechanical issue. You know, it's worth considering. It's worth maybe considering having a chat with their GP in relation to it. Or would it work? Or would it, you know, to use a natural product like Osteoflex or turmeric for a period of time? And you know, see, it's going on for 3 years.
She's, and she's 64 now.
And that needs to be you know, looked at, or maybe even a consultation with her consultant again, just to see is there any issues or inflammation within there, and how they actually would look at that. Like I've known situations, Ger, where people have got knee replacements, and they've actually the knee replacement itself has been rejected, and they've had a low-lying infection, or they've had a low-lying anti-inflammatory response to it, and sometimes that needs to be looked at as well. So the lady, before going down that road of hypnosis, I would suggest just having a chat with her consultant and GP before she goes down that route. Absolutely.
All right. Lady is getting pins and needles in the fingers of her left hand, but now they seem to be travelling up her arm. What would be the cause of this?
It could be nerve, Ger, it could be or it could be other issues as well. I'd like her actually to talk to the GP about that. You know, we're talking the left arm here, Ger. If it's running up the left arm, I'd like to know her age as well, and when was the last time she had her blood pressure taken. So in situations like that, if it's beginning to travel, especially if she's getting pins and needles in her fingers, sometimes that can be in the morning when you wake up, you may have lay on your arm and deaden the nerve, and you can get this pins and needles effect. But if it seems to be travelling, I would like her to talk to her GP in relation to that.
To be safe. All right, we're going to give you a chance to take your breath because it's coming up to 1:45. We'll have more questions for James to answer after these. We have a lot coming our way, but James, you did get some updates during the break.
I did. The wonderful Maria was in touch with me, and that product that I was thinking about was Newbit.
Okay.
And it's really effective at that neuropathic pain that develops after chemotherapy. And we would see a lot of people, even for people, you know, that we're talking there in relation to people with pins, needles in their hands and stuff like that, Ger. I have found that Newbit is very good for that.
Prescription?
No, you get it over the counter, Ger.
Okay.
And it's a very good combination. There's a lot of B complex in it, tetinomide as well. Really effective at just easing down that pain over a period of time. So
now,
it's well worth her going and checking that.
But when you answer this, how long do you need to take it before? Because people will be under the
3
impression...
months minimum.
Yeah,
Ger.
you see,
3 months is very important because the nerve
key.
lining is slow to heal. Yeah. It's exactly like we often talk with shingles. You got to take the product for a period of time. And I know somebody came in, Ger, and they mentioned Lyrica as the product I was talking about. It's not Lyrica, but that's a prescription-only medicine used for something similar. It's a little bit stronger, and that's more for the symptomatic relief, whereas the Newbit is more for getting at the underlying issue.
Now, next thing, a couple of letters.
Yes, Ger. I had a couple of letters that came into the office, and I'll just run through them quickly. The first one, Dear James and Jerry, I am a 48-year-old woman in good health. However, I've let myself go over past year due to personal problems. As it's the new year, I'm hoping to get my mind and body in a better shape. I'm feeling sluggish and tired. My bloods are good. Total cholesterol is 5.2. but diet is unbalanced. Could you recommend a couple of products I could take for a few months to kickstart me? I'm joining the gym. Thanks to you and Jerry, the show is wonderful. What I would suggest there for that lovely lady, Jer, is that if we recommend something to give her a kickstart and get her body up and going, say something like the Benefits Liver Blend and the Multifiber Plus, yeah, and do that for a month or two. And if she's going to the gym, to remember hydration, and if she's in the gym, talk to somebody about getting a little plan for herself that isn't going to kill her.
Okay.
You know, just build into it over a period of time. Think about the hydration, have a look at the diet, use the Multifiber Plus and the Liver Blend to get that feeling of feeling good about yourself.
Yes.
You know, and that's where you should find, you know, that your inner confidence and your inner belief will start to grow.
Take it from there. All right.
The other one, Jerry, it's I'll just give those one.
Sure.
Hi, I'm a middle-aged man in my 50s. I have a responsible job and have recently started on the journey of separation and divorce. It's very difficult mentally. I'm on no medication, but was wondering, could I take any supplement to help me with my mind and sleep? I am speaking to a counsellor whom I find very good. Thanks for your time. Jimmy. Well, Jimmy, I would recommend during this difficult time something to give yourself, your system a boost. So we recommend something like a Good Tonic Energy Plus. Rhodiola, we've spoken about that before, just to give the mind a bit of a lift for the next 2 or 3 months to get over the hump. And if the sleep is giving you trouble, first of all, it's good that you're talking to a counsellor. Secondly, have a chat with your GP. And thirdly, pop into a pharmacy, pop into our health foods and maybe get a good sleep in. The Benefit Sleep Blend, for example, very safe, very non-addictive, but just helps promote a good drowsiness in the evening time.
Perfect. All right, James.
Thank you, Jar.
So we go back on target now with the questions coming our way. James, would you recommend taking ginkgo biloba for memory as your age? Many thanks, a regular listener.
Some studies suggest that it is good for deterioration in age, especially with people with Alzheimer's and dementia, Jar. But there's variations in those studies. But ginkgo biloba would be more licensed for, say, circulatory problems, say, coldness in the hands and Raynaud syndrome and things like that. But there are some studies that suggest that it may help.
It may help.
It may help. So try it, but don't bet your life on it. That's what I would say there.
All right.
Okay.
James, what would you recommend for thrush at the back of the throat? I was on a lot of antibiotics and got reflux. Had the camera put down and the result came back to say it was thrush. I was on 50 milligrams of fluconazole. What's that, James?
Fluconazole.
Fluconazole for 2 weeks, but still no improvement. Thank you, says Catherine.
Now, Catherine, we're looking at that there, Jar, and we're seeing, number one, that our whole problem microbiome has been affected.
With all the antibiotics?
With all the antibiotics, Jar. 50 grams of fluconazole for 2 weeks is a strong dose.
Is it?
And that's an anti-thrush drug or an antifungal medicine. And that should have been clearing that up. So I would like for that patient, number one, if she can pop into her pharmacy, and she should be able to get something called Dactarin oral gel. I believe it's still available, and she should be able to get some of that. If not, she should be popping to her GP. Usually what we'd recommend something like that would be mycostatin oral suspension or an increase in the fluconazole dose. But it's very, very important that she starts on a probiotic. This is so important, Ger, because if you look what you just said there, I was on a lot of antibiotics. So that has, and she's got reflux out of it as well. So her whole system, right from top to bottom, is a little bit sterile. So she needs to get the good bacteria back in her gut, which will balance the fungal infection that's causing this issue.
What should she go on?
I would personally, any of the news, Biocult is very, very good. Udo's Choice is fantastic. Any of those, and use them for the next 3 or 4 weeks and get your system back up.
Back in action. All right, James, I get inflammation on the ball of my foot when I walk for any longer than 30 minutes. Walk every day, but have upped the distance in the last month to 50 minutes a day, and one foot has now become inflamed. No blister. I wear good socks and I wear Brooks shoes. Many thanks.
First of all, well done to be out there.
Yeah.
Ger. 50 minutes is good
going.
going, but it suggests to me that there's an issue there with her gait. And
the way you're holding yourself.
The way you're holding yourself and the way you're walking, and that needs to be looked at either by a physio or by a podiatrist. Yeah, because she's got very good socks and very good shoes there. Brooks shoes are very good for walking and running. But the issue there, it may not be the shoes or the socks. It can be the way she's actually walking, or if it's fast walking or slow walking. and she will need to get that looked at, where she may need a pair of orthotics, or she may need to manage her gait, and the physio or the podiatrist will be able to give her good direction on that. And I think it's important. Now, what was she doing, Jerry? She was gone from 30
to 50 minutes.
And up that in the last month.
Yeah.
It could have been a big jump. But again, she doesn't want to get to a point where if she's doing 50 minutes and she has to stop for a time because she damages it. So what I'd be suggesting there is let's get to the physio, let's get to the podiatrist, have a conversation and see can she improve it from there.
Okay. Caller has a dull pain on their left lower side. The doctor said it was diverticulitis. I don't have diarrhea or constipation. What would James think?
Well, if the doctor has suggested diverticulitis, Ger, and these are little pouches that can develop on the side of the gut wall, and the issue is that sometimes they get infected. The key there is probiotics and fibre. Yeah? Probiotics and fibre. So that keeps, in those little sacs that are off the side of the gut, if you can get your good bacteria in there, it stops the bad bacteria from infecting them, and that's where you get all your issues with diarrhea, constipation, because the gut reacts very badly. So keeping your gut moving, so with your soluble, insoluble fibre, multifibre plus, the benefits multifibre plus, fantastic, I'm taking myself, and you use that then along with a good probiotic, that's what will make your gut feel good. It'll give you that flat tummy, it'll stop that swelling that you're actually feeling. Especially sometimes with diverticulitis, you can get a kind of a swollen feeling, irritation in your gut. And the important thing here is that the fibre and the probiotic are actually getting at the underlying cause, and they're easing down the issues around infection.
Okay. And before we leave this section, could you please explain polymyalgia for a listener?
I'll tell you what, usually it happens in older people, Ger, and it's kind of pain and ache and inflammation around the neck, shoulders, hips. It's that idea that, struggling to get out of bed in the morning or lifting your hands above your head, and usually it's down to this prevailing an inflammation within the body, and there's an overlap between this thing and something called joint cell arthritis. But the good thing about it is it does respond well to anti-inflammatories, but it needs GP and consultant-led treatment.
Okay, and that's where you go from there. Yeah. All right, well, I'll tell you what we're going to do now. We're going to hold it to this section for the live section because time has run out, really, essentially. But for those who may not be able to rejoin us, it's malloyspharmacy.com, isn't that right, James?
www.malloyspharmacy.com.
And 096 60072.
Correct.
That's 096 60072 if you'd like to call James or his team, and they'll be able to help you in that way. And what we're going to do now is we're going to transfer to Studio 2 and deal with all the calls that we didn't get to do live on the programme. So thanks for being with us for this section, James. Back next month with God's help. Thanks to you, friends, for being with us, and to Patrain and all the team for working on the programme. Let me say that May's time is almost 12:57.